Do you ever feel like you have bad breath no matter what you do? You brush your teeth meticulously, you floss every single day, you use mouthwash, but that persistent, unpleasant odor just doesn't seem to go away. It's frustrating, and it can make you feel self-conscious. Many people assume the cause is something they ate, or maybe a problem coming from their stomach. And while those can be factors, what if the real source of the problem is hiding in plain sight, right at the back of your throat? Today, we're talking about a very common but often misunderstood cause of chronic bad breath: tonsil stones. We're going to break down what they are, why they happen, and most importantly, what you can do about them. So, what exactly are these white bumps in your throat? Tonsil stones, known medically as tonsilloliths, are small calcified formations that develop in your tonsils. They're essentially a compacted mixture of things that get trapped there. This includes tiny food particles, saliva, mucus, and dead cells. Now, here's where the problem starts. Your tonsils aren't perfectly smooth. They have small pockets, caves, or crevices on their surface called tonsillar crypts. These crypts are the perfect hiding spot for all that debris to accumulate. As this material gets trapped, bacteria begin to feed on it. This bacterial feast produces smelly sulfur compounds, which is what causes that distinct, foul odor associated with tonsil stones and consequently bad breath. Over time, this debris can harden and calcify, forming a small, white or yellowish stone that can be either soft and mushy or hard like a tiny pebble. So, if you've ever coughed up one of these strange-smelling little nuggets, you've experienced a tonsil stone. But why do some people get them while others never do? It's a great question, and it's more common than you might think. It's estimated that around 10% of the population experiences tonsil stones at some point. The primary reason comes down to individual anatomy. The main risk factor is having tonsils with deep and complex crypts. Think of it this way. If your tonsils have very shallow pockets, debris gets washed away easily when you swallow or drink. But if your tonsils have deep, winding caves, it's much easier for debris to get stuck and build up over time. Having larger tonsils can also be a factor, simply because there's more surface area and potentially deeper crypts available to trap material. Additionally, people who have a history of frequent tonsillitis may have scarring on their tonsils, which can alter the shape of the crypts and make them more prone to collecting debris. It's important to remember, though, that this isn't a hard and fast rule. Some people with small tonsils can still get stones if their crypts are deep, and not everyone with large tonsils will develop them. It really comes down to the unique structure of your tonsils and their ability to self-clean. When you see one of these white bumps in the mirror, the first instinct for many people is to try and get it out. You might be tempted to use a cotton swab, a toothbrush, or even your finger to poke or scrape at it. However, from a safety perspective, trying to remove tonsil stones at home is generally not recommended, and here's why. First, the tissue of your tonsils is extremely delicate. It's very easy to cause irritation, scratches, or bleeding, which can be painful and lead to more serious problems. Second, by using non-sterile objects, you risk introducing new bacteria into the area, which could cause a tonsil infection or tonsillitis. You could turn a simple annoyance into a painful medical issue. Third, you might accidentally push the tonsil stone or the surrounding debris even deeper into the crypt. This can make it more difficult to remove later and can lead to more inflammation. And finally, for many people, the gag reflex makes it nearly impossible to access the area safely and effectively without causing discomfort. While a very small loose stone might come out on its own when you cough or gargle, actively digging or scraping at your tonsils is a risk that just isn't worth taking. If a tonsil stone is visible and causing you discomfort, the safest and most effective route is to seek professional help. If a tonsil stone is visible and causing you discomfort, the safest route is to seek professional help. However, before we cover the traditional medical routes for severe cases, it's worth knowing that many oral issues, including the bad breath caused by bacteria, often stem from a single root cause that brushing and flossing can't touch. Recent research has revealed a shockingly simple 5-second oral flush that targets a hidden bacterial biofilm deep in your mouth, helping to eliminate bad breath at the source while strengthening teeth and gums. If you want to see a short video that explains how this powerful natural method works, point your phone's camera at the QR code on the screen now. I've also put a link for it in the pinned comment below this video. Now, for those dealing with severe recurring tonsil stones, it's also important to know the definitive professional solutions. So, what are the real solutions? When tonsil stones are causing persistent bad breath or discomfort, there are several effective medical options available. For occasional stones, an ENT specialist, that's an otolaryngologist or a doctor specializing in ER, nose, and throat, can safely and easily remove them right in the office. They have the right instruments and lighting to do it without causing injury. But the bigger question is, what if they just keep coming back? If you're someone who is constantly dealing with tonsil stones, you're probably looking for a more permanent solution. The most definitive solution for chronic recurring tonsil stones is a tonsillectomy. This is the surgical procedure to completely remove the tonsils. The logic is simple. By removing the tonsils, you are removing the crypts where the stones form. If there are no crypts, there's nowhere for debris to get trapped, and therefore, no more tonsil stones. This procedure is performed under general anesthesia and is typically an outpatient surgery, meaning you can go home the same day. It permanently solves the problem. You may have also heard of another technique called laser cryptolysis. This procedure uses a laser to reshape the surface of the tonsils, essentially making the crypts shallower so they don't trap debris as easily. While it can be effective for some, it's generally considered less definitive than a tonsillectomy. The reason is that it can be difficult to treat the deepest parts of the crypts, so recurrence is still possible. So, to summarize your action plan, here are the key takeaways. First, if you're struggling with bad breath, always start by ensuring your dental health is in order and consider any potential gastrointestinal issues. Second, if those causes have been ruled out, the problem could very well be tonsil stones, especially if you've noticed those small white bumps in your throat. And third, and this is the most important point, avoid the risks of trying to remove them yourself at home. The best step you can take is to get a proper diagnosis. Schedule an appointment with an ENT specialist. They can thoroughly examine your throat, confirm if tonsil stones are indeed the issue, and discuss the safest and most effective treatment options for your specific situation, whether it's simple removal or a more permanent solution. You don't have to live with the discomfort and anxiety of persistent bad breath. Understanding the true cause is the first step toward finding a lasting solution. Thanks for watching.